So welcome to a discussion today on a topic that has been sort of very important to us at One Up Health, this idea of everyone has a story, and I'm joined by Miriam Paramore, and we'll get into it in a second. But the idea behind this concept is that we all experience the healthcare system, some of us every day, some of us through family members, some of us through the work that we do. And I don't think that we love doctors and nurses, by the way, but we're not satisfied with the way the system itself operates. And so we think if we can highlight, through this idea that everyone has a story in healthcare, some of the issues that we're all dealing with, that we could then collectively work to solve for them, because it's not okay. It's not okay to spend $4 trillion and be ranked lowest in the world in outcomes. It's not okay to spend the kind of money we do and not have the care that we want. And then it's also not okay if we sort of just let it be the way it is. So we're here to start telling these stories, and Miriam is our first in this series. And she's going to tell you about, the loss of her dad and the struggle he had working through the system, trying to get the best care he possibly could. And by the way, at a very high price tag, with not the outcome that we would have liked to have seen. One Up Health, our goal is to build a data platform that lets data move better between a patient, a provider, and a payer, so that ultimately we can have lower risk and better care and better quality and a better experience for all. And that's our mission and our objective, and we're going to stick with that until we get that to happen. So Miriam, thanks for spending a little bit of time with me today. And of course, we're very sorry for the loss of your dad. He was an amazing guy. So maybe we can start there a little bit. Tell us about him, and then we'll get into some of the details.
Okay, great. Thank you, Joe. I appreciate the opportunity to share my dad's story. And my father, Jack Paramore, passed away on July 18th of this year. And he was really a wonderful father. So it's very fresh. And I don't know if I'll get emotional, but I might. So we'll see. But I've had a little bit of time. And he was the son of a farmer in Eastern North Carolina who decided to become a preacher. He was actually an evangelist. He had a spiritual experience at the age of 18 and, left the farm. And that wasn't a popular decision, but he really followed what he felt he was compelled to do. And he lived a life of service, and he really, really loved people. And he loved bringing the good news as he saw it to people, but he really wanted to help people. And he taught me a lot about openness and warmth and living life with an open heart. And he also taught me a lot about persistence and resilience and courage, and how hard it is to really be strong in the face of aging and illness management. Quite inspiring. And so, my career story is that I have nearly 40 years in the healthcare industry, focusing on hopefully improving the system through the things that I'm able to do from a skill perspective, which is all around the power of information in the healthcare system. So it's in many ways analogous to, or similar to, complementary to the One Up Health mission. And so I'll just briefly outline the last few years of my father's life. He suffered from, when he died at the age of 87, he had multiple comorbidities. He had heart failure. He had kidney failure. He had melanoma. And then he was a person who suffered from sleep apnea, and really severe, to the degree that when he was staying at my house one time a couple of years ago, I stood at the doorway of the bedroom, and with his CPAP machine on, watched him, timing out, like this has been like a minute between breaths, to the point that I'm going into, is my father still alive? And the biggest failure that I saw in the healthcare system was the lack of care coordination. My dad lived in rural North Carolina, and you can imagine with those different comorbidities how many providers he had. So he had a primary care physician, country doctor. He had a cardiologist. he had a dermatologist, he had a nephrologist, for his kidney disease. And then as his kidney disease progressed, he ended up, going to a dialysis center. He was in and out of the hospital multiple times in the last few years. And he had an orthopedic, type of a doctor. So you're talking about at least 7 different healthcare providers in 7 different settings. And, a couple of things happened that I think are illustrative of how damaging the lack of care coordination is, both from an outcomes and a cost perspective. But in my dad's case, he had more blockage in his heart, and he needed a stent, at least one, put into one of his arteries. But his kidneys were not functioning well, and the creatinine levels that they watched had to be at a certain place. So there needed to be this coordination between how healthy is his heart and how healthy is his kidney, so that neither one of them, kind of failed when there was an intervention like the stent. And we sat back helplessly as nearly a year, it was between 9 months and 12 months, went back and forth with Dad going, well, I've got to go see the heart surgeon, and I have to go see the kidney guy. And the kidney guy says, we can't have the heart thing until my numbers get to a certain place. Of course, he doesn't really understand these things. Myself and my sister, and even my half sister who lives locally with him, she's even a nurse, are trying to access his medical records. Now, keep in mind that at this point, he's 85, 86 years old, driving himself multiple places when he doesn't have a driver's license because he can't pass the test, and not understanding. And he was suffering from pain from this osteoarthritis and this degeneration in his hip and knee. So he had Celebrex and maybe one other pain reliever, and he was weaned off of all of those pain relievers. He was down to Tylenol, 2 Tylenol twice a day, excruciating pain, because those pain relievers metabolize in the kidney. So no one was treating my father's pain. And when I talked about resilience and bravery, his ability to get up and push himself to keep moving, go play golf, things that you know about in terms of keeping your body in motion, Joe, was absolutely astounding. That it was horrifying to watch him degenerate while he was in so much pain, and then lose his mobility, not be able to get the kidney function at the place, so he couldn't get the heart function at the place, so he had swelling in his legs, and the whole life becomes very, very small, and the life becomes one that's about pain, and it's not quality. And so there was enormous amount of wasted time before he finally had the heart procedure, and then the kidney disease progressed. Which, by the way, another thing that I've learned in this process is that, when we learned as a family that Dad had kidney disease, Joe, he was already at stage 3.
Yeah.
And I've learned that kidney disease is typically not diagnosed until patients are already 3 or 4. So the progression is so far down the path, it's like too much damage has been done. So, well, why isn't that happening? So I'm now part of a chronic kidney disease CKD initiative that QC Health is doing, or where we're trying to promote with primary care some simple diagnostics, or at least, early diagnostics for finding this kidney disease earlier. So, I said a whole lot there, Joe, and I can kind of stop and unpack that, but there were so many things that as he got sicker,
got harder.
It got harder and harder and harder, and there was no one to help him navigate or coordinate. And as I said, I think maybe in my post, it was no one's job.
No, but right, the system isn't designed for that, especially maybe Miriam, before any of us were around, and there was just the one doctor came to the house, and they would have to be end to end, right? They knew you and they could do something. But now we have this distributed environment. It's all these subspecialties. Care coordination is not a responsibility directly. The payer might play a role, the provider tries, but really isn't incentivized in that direction. The family doesn't know enough. The sort of, without problem solving too much, but talking some more about how this manifests, the data though does see, because there's a lot of coordination, but the data doesn't move, right? It gets stuck in a health system or in a record or in something else. And so therefore, even if we wanted to today, we don't orient ourselves in that way. Do you have a sense of how much was really could have been known but not acted on because the system doesn't work that way?
Well, yes. So we even got access to, I think, the hospital system that Dad experienced used Epic. And so we were able to get into his My Chart, and you can see some results, of certain tests. I also had access. I was helping to manage his insurance side. He was a Medicare Advantage patient with Humana, and would go into his portal and try to, understand who are all of his providers, what are all of his medications. And then, there's a patient access thing that I think you're familiar with, where people need to, supposed to be able to get their information from their health plan. So I got my dad's information. I'm going to do a write-up and a post about this. It's literally looks like a spreadsheet printout of, diagnoses with words that make absolutely no sense unless you're an expert in the industry and you know what you're looking at. So completely unhelpful, certainly for, someone like my dad. So the data about test values, the data about diagnoses were in separate systems from the separate providers. They weren't shared. Yep. When we get into dialysis, they had a different system, and we tried to take advantage of transportation options. We found, to my surprise, that Medicare Advantage doesn't cover that. Medicare does, but not Medicare Advantage. So that was my post about Medicare Disadvantage. And then there's, data traps around, why, since Dad had the test results from both the heart surgeon, the heart guy, and the kidney guy, why did any discussion have to wait 3 months, run the test, get the results? Dad, no one talks about the results until the next appointment. So if the primary care doctor or someone were acting as the coordinator, as soon as these numbers get to a certain point, we're ready to schedule the surgery. But Dad's experience was month to month, doctor to doctor, pull up the report. And it makes, absolutely no sense, but it makes perfect sense, because as we talked about before, the stakeholder alignment, whose job is it to holistically care for my father? There was no one party. The closest I can get, Joe, and I don't want to do too much with data and problem solving, but the health plan did have visibility across everything.
They could one day, they still don't have. Imagine if you changed insurances, right, during that period of time, the data is stuck in where it was. In this instance, you probably did have some centralized medical data because he was probably cared for at one facility. But these are all, doable, right? I mean, interstate commerce allows for data to move anywhere. The data systems don't have any, sort of anything against it. I mean, if we look at every other major business that, if you join a loyalty program for American Airlines, it doesn't only work if you fly out of Tennessee or out of California. And if you, become a member in Target's club, you'd get credit if you shopped in any Target stores. I mean, these concepts aren't hard, and the data platforms allow for this information, and we can do it securely, right? I mean, it's not like a HIPAA is an excuse sometimes, but it's not a reason we can't have data move securely. We know how to secure data.
And it is a total excuse, to your point, because, treatment, payment, and healthcare operate. I mean, that's the whole reason that we even have information, is to, better inform the care. So, we of course want it, but, I can't stress enough, Joe, that the lag time, the elapsed time during which my father continued to get worse and worse, and continued to suffer, and continued to lose mobility and dignity, and joy was because he would schedule an appointment with one specialist, have a test. Nothing happens till the next time he comes around, which is, 30 plus days. Then there's an appointment with the other specialist. So this data-driven approach where there's some sort of shared data minimally, but then there's some sort of care coordination, decision-making action around this patient should not be waiting 4 to 6 weeks with no action in between appointments. And and then having to drive to all these different, 45 minutes, get in the truck and go 45 minutes in one of, 7 directions to get to that particular doctor. Cause it's not like they're all on the same campus or anything.
No, but like you might get a notification this afternoon from your credit card company that says today, 4 minutes ago, there might've been a transaction that did you execute on, right? Like we know in real time what's happening in data streams.
Well, exactly.
Here, where our health matters, we're sitting on data because, well, we started with paper and then we built proprietary systems and we didn't agree that it would matter to share that data. And so, but the implications, as you're sort of highlighting, they're real. They're real. Okay, so the care plan, care coordination didn't work. What about, Miriam, the cost that came from this, the retests, the actual length of time, the severity of what happened? Tell us a little bit about that too.
Oh, yeah. Well, I'd like to just put a bookmark. I'd like to come back to prior authorization and before we end.
Yeah, sure.
If we could, but on the cost side, looking at things from Humana's records, my dad's records, he did get into dialysis at a DaVita dialysis center in rural North Carolina, in Wallace, North Carolina, in February of this year.
Okay. And
my sister and I were visiting, and we went with him to the dialysis center and to the spoke with the nurses, spoke with the doctor. Let me just ask you to guess. What would you guess one day of dialysis costs? Any idea? In a dialysis center.
Yeah, like maybe a couple $1,000.
$3,790 per day. And he went every day. And so his healthcare bill, if you looked at the last 18 months of his life, it went from a burn rate, I'm a business person, so these things just come out of my mouth, but it went from a expense of roughly $25,000 a month, which is still a ton of money, wow, to $125,000 a month for the last 6 months of his life. So his total claims for the last 6 months of his life was $773,000. Now, we have all heard that statistic that 95% of the money that each of us spend on healthcare will be spent in the last 5 years of our lives. And we all understand, some of the drivers behind that. And when if I ever show this or put it in a post, which I probably will, you'll see that the Humana discount against the $773,000 is $749,000 or something. And then there's some other kind of discount applied, and then there's the patient responsibility. And so dad's responsibility was, maybe $1,000, a couple thousand, at the end of that. But all of that just infuriates me, because what are we even doing if we say that it's $773,000, but it really isn't, because there's a negotiated rate of, thank God that Medicare Advantage program existed and that he was enrolled in it, because everyone is one healthcare event away from bankruptcy. Everyone.
Yeah. Oh, yeah, for sure. I mean, the amount of bankruptcy is only going up.
My father was very, my father did not have money. Mm-hmm. And my sister and I supported him financially for a large portion of his latter years. There's no way that he could have afforded. In fact, there are bills outstanding now that you know, will be tough. You know, we'll see how those things happen. And then, you know, he ended up being able to come home and do in-home dialysis, but there's a whole, you know, I could do a, and of course the cost changed dramatically, but you know, just the basics of, let's get in a car, let's drive 45 minutes, let's go somewhere for a process that takes 1 to 2 hours and pay $4,000 a day to do that. There's something wrong with that.
Well, for anyone listening, it's fine, incomprehensible, right? I mean, we're putting people in medical bankruptcy. You know, the percent actually, what's even crazier, Miriam, as well, is that people are now not going to get care because the cost is too high. So we're doing it on both sides. We're bankrupting you, and then you're not going to go get the care because the system isn't working. And then you mentioned, you know, one of these things that everyone sort of has some sense about and is frustrated with this prior authorization, which is getting the right to be able to pay for something through this insurance that we think is supposed to pay for us. What's
yeah, that part of the story, try to quickly touch on it. So my dad had really severe sleep apnea. So he has heart failure, right? Even before the kidney failure. So he's got all kinds of a compromised, you know, breathing. And so whenever he would travel, and I was blessed to be able to spend a lot of time with him in the last 3 years of his life, at his place, at my place, travel, you know, we did as much as we could based on his mobility. And he really, really pushed. So I saw him travel with his CPAP machine. And about 2 years ago, he came, I went, picked him up, he came for a visit. I said, well, Dad, where's your machine? And he said, well, it broke and I'm waiting for them to, you know, send me another one. So 3 months go by, no CPAP machine. Dad, how's that? What's going on? How is that? They're waiting on a prior authorization. Joe, you could have, like, I felt like I was going to come out of a cannon. I said, what? Hold the phone. He's had that diagnosis for years.
right?
You know, it's been in his claim history for years. He went almost a year, and it was to the point where I was saying, Dad, I'm going on Amazon right now. I don't care what it costs. It's be there tomorrow, you know, because he's no longer able to breathe and rest. So, I mean, literally can't breathe, Joe.
I know.
And they're saying it's some prior authorization when that's ridiculous. That it's just ridiculous. And what he would hear, you know, he would be at the doctor and there's some, you know, assistant who's doing paperwork and sitting on the phone, and we're waiting to hear back from the insurance company, and they sent us this. Insane. Yeah. So, you know, what you and others are going to do to try to improve the prior auth process, I am all about that. And I think it's cool. I think it's not difficult to do. I know it's not difficult to do technologically. It's a matter of will. But the larger question is, people are hurting. People are suffering. And my father hurt and he suffered. And that's wrong. You know, that it shouldn't be the case that you
in a first world country. I think there's an issue of aligned incentives and aligned goals and objectives, right? And that in a third-party payer system, you know, why they have prior authorization is there's no true alignment with what the provider needs to do and the patient. We have a history that says, you know, we didn't trust the way a system works, so we put in these rules. We all know this. Over time, what happens is the initial intent never really turns out to be the reason we continue. And, you know, I think, Miriam, it's a very sad and disturbing story, and not just for you and your family, but because this is a pattern that exists. Why we're doing this, Everyone Has a Story series, because we went to, you know, dinner tonight with 4 or 5 other people, and we just asked everyone, they would all have their version of a story like
absolutely, this. Absolutely. Unfortunately, ours is not unique. My father's is not unique.
And we have to just commit to leveraging, you know, there are some movements afoot in Congress around prior authorization and moving to more of a real-time permissioning. And even at least if you knew you weren't approved, you might have some alternatives. You know, we're working towards data standardization that should get us to move. But But we have a big system here to shift, and it's going to take a commitment on behalf of everyone, and brave people like you who are willing to bring up to, you know, sort of the public eye that it's not okay to have this outcome, to have a system work this way, to kind of have spend the money we are, and to really actually get, what are we getting out of it? We're really not much, right?
Yeah.
We're sort of missing the key point here, right? We do have a rather sophisticated healthcare system that could provide better care to people. We all want to live, you know, happier, healthier, more vital lives for the time we are here. We're going to just have to work collectively to continue to bring up this kind of point so that we can do something practically and make it better for, you know, someone else who should get a better care experience than your dad did. And really appreciate you telling your story, Miriam. Thanks for that.
Well, thank you, Joe. That's my hope. And that's why I still have passion for the power of information to help improve our U.S. healthcare system, and really believe in the work that you're doing. And I'm very grateful to be able to talk a little bit about my dad. He was such a fighter. And despite all of these challenges, he really didn't complain. He was just baffled, you know, Joe, and he just tried to do the best that he could. He was very, very compliant. And he, you know, he soldiered on. So I'm grateful that he's at peace and resting.
Yeah, and we'll remember him and all the great things he did in his life. So thanks, Miriam. Appreciate it. And our thoughts are with you throughout.
Thank you, Joe. Appreciate it.